Hey guys, Rex Sanders with Pathway Training here along with Brad Perry from Kingwood Physical Therapy. This is running form for beginners, so we have a run expert, a run master here with us. Brad Perry was recently featured in Runner's World magazine, works with the Institute of Athlete Regeneration, and you're touring this year with USA Tri?
Yep, USA Triathlon.
Yeah,
yep.
Man. Helping everybody stay injury-free out there as they're traveling the world hitting these.
That's right. Yeah, it's with the World Triathlon Series.
Yeah.
So I'll be helping those guys out.
That's awesome, man.
Yeah,
That's some
pretty
good tips.
Yeah.
So, running form for beginners. Break it down for us, man. What do we need to look for when you're just trying to get started?
Pain, no pain.
Right.
That's always good to start there. We'll talk about some basics of what to look for. We'll get Rex on the treadmill, and we'll kind of go up the chain and see what's going on.
Yeah, I'll try not to be too perfect with the form for you. But yeah, so when you're trying to get started, looking for that pain, like you said, do you want people to go out there and feel it first, then kind of see how they feel from there?
Yeah, go out and run, see how it feels, and hopefully there's a plan, right, of doing only a certain amount of running versus going from 0 to 10 miles overnight.
Absolutely.
Right? And so we'll get there gradually, and so that first time you go out and run, yeah, don't think about it too much. Go out for a little nice, easy run and see if you do have pain. And we can talk about kind of where to look for pain and where pain shouldn't occur versus muscle soreness.
Sounds good. Let's get into it.
All right, I'm gonna get Rex running here, and then we'll talk about a few things that we're looking for and not looking for when someone's running. So, a couple of things. First thing, when I put somebody on the treadmill, I'm listening to see how they're running. So, if they are making a lot of noise when they're running, that probably means that they're hitting the ground too hard. And when you start to hit the ground too hard, it can cause a lot of forces to go up and into the joint. And we call that ground reaction forces. So we want them to run as quiet as possible, and that helps kind of correct a lot of the things that we talk about in running form. All right. The other thing, and we got this angle from the back because we're looking at the feet a little bit. So what I see a lot is people will start running with their foot out. You can kind of see Rex here. He's kicking out here, and that can cause some issues in the big toe, the foot, ankle. And so we want to maybe look at that and see where your foot is landing, and if it's landing straight on versus getting that heel or that toe out, okay? So we can correct that with a few different exercises sometimes, or just being aware of it really helps the most. And then the other thing is someone who scissors, okay? We call this a scissoring gait, or they're crossing over midline. So to know if you're doing that, you can either get on a treadmill and film yourself, or you can go out to a track, something with a straight line, and run down that track to see if your legs are crossing over midline. And that gives you a lot of feedback whenever you're running, okay? Then some other things to look for. Of course, we talked about maybe not having pain in certain spots. So whenever you're running, you shouldn't have too much pain. Now, there is a such thing as delayed onset muscle soreness, and that is going to be different than if someone's having some kind of joint dysfunction. So pain coming from like the ankle itself is different than if it's coming from the calf, all right? So muscle soreness can take 24 to 48 hours to sit in, and then if it's joint pain, sometimes the body needs a little adjusting for that as well, but if it lasts over 48 hours, you might want to get it checked out, especially after you've gone out for your first run. And the next joint we're going to look at is the knee. So if we come up from the ankle to the knee, right here, Rex is trying to run with his knees in together. We see this a lot, okay? The knees kind of come in and they touch. Sometimes people will say, hey, sometimes I feel my knees touching when I'm running. We want to try to land with those knees right above the foot and not inside the foot. If that makes sense. So if I were to draw a straight line straight down, I want the knee and the foot to be on the same angle versus his knees were kind of coming in together, and that's what we call knee valgus, and that's going to put a lot of stress on the knees. All right, now we're moving up the chain and into the hips. And so what can happen at the hips is what we call a hip drop, and sometimes it'll occur on one side where the hips will shift on one side more than the other, or it could be coming from both, and you'll get what we call a Trendelenburg, but it's a hip drop as they're running. So we want to stabilize those hips. Sometimes it's hard to do if you've got some glute medius, this is the muscle over here that helps stabilize. If those are weak, it might be difficult to do. So always great to incorporate that into training. Make sure that it's strong and stable to put less pressure on your hips when you're running, okay? And so whenever you're running, sometimes you might get some glute soreness, even on the side. And that, again, that's muscle soreness, and that's okay. Unless it lasts more than a week or so, then you might be looking at a strain or some type of itis, like tendonitis or something going on. So we want to make sure those hips are nice and stable whenever you're running. So you can kind of film yourself on a treadmill. It's always best, actually, if you tuck in the shirt, you can kind of see if they're dropping or not as well. And then if you're having pain every time you go out in the hips, of course, let your trainer know, okay? The next thing we're going to do is roll right up into the spine. Yeah, this is the old Rocky run, right? The guy, Rocky was, you know, he's got a lot of motion whenever he was running. But sometimes people have almost too much. And so you'll see he's kind of rotating more on his right. And so by rotating way too much, we basically don't want to cross midline with your elbow or with your fist. So from the front and the back, you can kind of see sometimes if you're rotating too much, that fist is going to come across, right? Or if you're in the back, that elbow kind of comes back a little bit further than the other side. And so you can kind of see his right one's coming across there a little bit more, okay? And that can cause problems in the back. So if you go out for a run and notice that your back is causing you a little bit of soreness, just something to kind of look for, right? Whenever you're running. So this one is called the bouncer. You can kind of see he's bouncing. We don't want to bounce more than about 4 inches off the ground when we're running. So we want to make this smooth. This kind of comes into the effect of like whenever you're running and there's a lot of noise happening at the foot, there's a lot of compression into the ground. Same thing, try to run softer, smoother. Think about moving forward and not straight up and down. A lot of people will bounce. One thing you'll see sometimes with the ladies, they're wearing a little ponytail in the back, and it will be bouncing way up versus a nice stable little bounce, okay? It's okay, of course, to bounce, just not more than about 4 inches or so. Okay, we're going to look up the chain from the bottom up, and we're going to look at the foot from a side angle and see what's going on. So a lot of people are overstriding when they first start out, and overstriding can cause a lot of issues from the ground going up, because whenever overstriding, and Rex is kind of doing it here, he's landing in front of his center of gravity, right? And so whenever you overstride and get in front of your center of gravity too much, you think about it, it's like almost like pushing the brake down. You're really braking and causing more compression to go up and into the joints. And so people will start to have, you know, knee pain and hip pain because they're overstriding and making a lot of heel contact, okay? So what we want to do is kind of fix that and try to land right underneath your center of gravity, right? So that foot placement should be right there. So he's kind of corrected it now, and that's going to decrease the ground reaction forces so he doesn't have as much pressure going through his ankles and joints, right? Okay? So that's the biggest thing we see is the overstriding and from the foot. Now if we go up to the knee here, if someone overstrides and makes too much of a heel contact, their knee gets really straight. So as he comes out, when they land the knee straight, it's actually okay to land with the knee slightly bent, okay? So whenever your foot lands right underneath your center of gravity, the knee is going to be slightly bent, and that's okay. All right, so it's different from walking. Whenever we're walking, we usually get that knee fully straight and we make heel contact. So when we're running, we mix that up just a little bit to cause a little decreased compression at the joints, okay? So we want the knee to be bent a little bit at ground contact, and then we want the knee to, of course, go into flexion. So we want to bend it and bend it up to about 90 degrees or so whenever you're running. And whenever we do that, that helps increase the elasticity in your hamstring to help with the efficiency of running, basically. So we want to bend the knee a little bit more, and that will help, again, with the recovery time coming back and wanting that foot right underneath the center of gravity there, okay? And then if we move up into the hip, the biggest thing we'll see there is they're not getting enough hip extension, okay? And that kind of comes back to like landing. If they're landing in front of the body too much, and then they're just going to lift their foot up in the back just a little bit versus bending the knee and letting the hip go into extension. So whenever we land here, we want that hip to go back a little bit more and not also he was starting to rotate there. That's another thing we'll look for is rotation at the hips. And earlier we were looking at it from the back. So same thing can happen if that hip is not extending, they'll start to rotate. So when I talk about hip extension, this is the motion. So we want knee flexion, hip extended a little bit whenever we're running, okay? And that way we get the hamstrings and the glutes involved versus if they're here and then pick up their foot and just have that turn over here, then they're just kind of working their quads and calves. So we want to get the whole complex moving and working, all right? We talked about arm swing from the back, so same thing here. You can kind of see if your one arm is swinging a little bit more. The other thing I might tell them to do is keep their hands a little high and tight. So sometimes I see people running like this, right? Loosey-goosey like that, trying to stay relaxed. I get that, but it's not too efficient. So we want to bring the arms up, kind of high and tight here, and just make sure, again, you're not rotating too much, okay?
So we just shot that joint-by-joint breakdown, and this is a lot of good information, right? Mm-hmm. Running is complicated. Like sometimes you got a few things going on, right?
Right.
So what would be the best way that people could utilize this information?
So I'd just say, first of all, just kind of go out for a run and see how you feel, right? And so if you have pain while you're running, then you can kind of start to analyze your gait, right? And that's kind of what we just did, was break that down. So if you go out for a run, and of course running, if you haven't run in a while, right, you're going to be a little uncomfortable. And so we always go back to the pain scale, 0 to 10. 0's no pain, 10's emergency room pain. And so when you go for that run, it might be a little uncomfortable, right? And that's why coaches, make you run for punishment, right? I've always done that. And so we want that pain scale to probably be less than a 4, right? 3, 4 might be okay. It's a little uncomfortable, especially the first time you go out. And it might be in the muscles, it might be in the joints, and that's okay because your joints have to kind of adapt to it. Your muscles start to adapt to it. Now, if the pain gets above that and it gets more moderate to severe, being like 5, 6, then you might want to shut it down and maybe go for the walk and break up your intervals a little bit and see how so you try to modify that part first and see how that feels. And then if it does cause pain, you can kind of look at some of these videos to see where your pain's coming from, right? And so you can look at your foot position, like we talked about on the treadmill, and how that foot position might be causing your foot pain, and try to correct that. If it doesn't get corrected, ask your trainer maybe some corrective exercises, right? If it doesn't get better after that, I would say after a week or 2, then you might have to seek some medical care, which, physical therapy, of course, I'm going to promote at that point, and kind of getting checked out to see how that joint's moving and how the muscles are being affected, right? So make sure, you're not in too much pain. A little bit of pain you're okay with. Again, delayed onset muscle soreness is usually 24 to 48 hours after you run, so that's okay too. So if you're sore for 2 days after you run, it's really okay, right? You're gonna live.
Yeah. There you go. So it's okay to be a little uncomfortable. Make sure you're not in pain. And this is progressive, right? Like you're gonna get more comfortable with running. You're gonna find your rhythm for it. Get out there, get moving, and enjoy running. Cool. Let's go.